Good evening, dear students. Today we are going to discuss about some important aspect in pediatric X-rays. This topic is mainly meant for pediatric undergraduate students. Whenever you want to read an X-ray chest, the following things should be given importance. What are all those things that should be given importance? Okay, the following things should be given importance. Otherwise known as, this approach is called as ABCDE approach. What is called A? A stands for airway. A stands for airway. That is how you see your trachea as well as your mediastinum. That is in and around the trachea. B stands for breathing. Breathing means your lung volume. How the lung volume is due to. Okay. Whether it is high lung volume, low lung volume, etc. Second one is aeration. Aeration means if the lung is more black means the lung is more aerated. Less black means less aerated. Third one is cardiac. When you look into the heart, you will see whether the heart size is large or normal. Second one is there any peculiarities with respect to the heart shape? Those things can be easily picked up in a neonatal X-ray just with respect to congenital heart disease. D stands for diaphragm. Diaphragm means you need to look whether both diaphragms are at the same level, or one diaphragm is above or one diaphragm is below, or you can also see whether air is under the diaphragm to look for air leak syndrome. Right. So this is called ABCDE approach with respect to pediatric X-ray chest, or else in any other X-ray chest reading. And above all, you need to see one important thing. What is that most important thing that you need to see? The thing that you need to see whether that X-ray belongs to the patient. So name of the patient, check whether you are looking into the X-ray of that patient name. Second, age of the patient, whether that X-ray has mentioned the name of the patient, age of the patient, sex of the patient, as well as date when it is taken, because they would have given you an X-ray which was taken a week back or 4 weeks back or 4 years back, but the present condition of the patient doesn't suit the old X-ray one. That's why you need to ask for whether the name is correct, age is correct, sex is correct, and date when it was taken. After confirming all these things only, you need to look for the findings of the X-ray chest in the form of ABCDE approach. Right. So what are all the things that you can see in an X-ray chest? What are all the things that you can see in an X-ray chest? The answer is very simple. As I told you, A. A stands for airway. I repeat, my dear friends, A stands for airway. So look at this airway. What is this? This is your trachea. This is your trachea. So A stands for airway. First point, how whether the trachea is in the midline, whether it is pulled to one side or pushed to one side, whether trachea is in the midline or not. So A stands for airway. Second one is B. Second one is B. B stands for breathing. Breathing means with respect to lung. So look at this lung. This is the volume of the right lung, and this is the volume of the left lung. This is volume of the left lung. Remember, you need to compare the size of the volume of the right lung with respect to volume of the left lung. Relatively, you all know that majority of human beings, the right sided is dominant one. That's why your right lung volume should be little bit more compared to the left lung volume. Second point. Third one, aeration. What do you mean by aeration? Air that goes inside is called as aeration. If more air goes inside, your lung will become more black. If less air goes inside, your lung will become less black. So more black means more aeration, less black means less aeration. So one is airway, second one is lung volume, otherwise known as breathing. Third, what is that third one? In third one, A, B, C stands for cardiac. C stands for cardiac. So look at this. This is the heart. Look at this. This is the heart. So what is the border of the heart? Look at this. So this is your border of the heart. So this is the inferior border of the heart, which is formed by which is formed by right ventricle. The inferior border is formed by right ventricle, and you have a right heart border and left heart border. So this is the right heart border. Right heart border upper 1/3 is formed by, look at this, SVC. And then majority of the right heart border is formed by right atrium, and some amount of right heart border lowermost part is formed by your inferior vena cava. So the right heart border is formed by superior vena cava, right atrium as well as inferior vena cava, whereas your left heart border is formed by, look at this. So this is the left heart border. So what are all the things you see in left heart border? Let us see one by one. What are all the things you will see in left heart border? In left heart border, the first bulge is called as aortic knob. First bulge is called as aortic knob. The second bulge is called as pulmonary trunk. The second bulge is called as pulmonary trunk. The third bulge, first bulge aortic knob, second bulge pulmonary trunk, third bulge is your left atrial appendage. Third bulge. And then you have your fourth bulge, which is formed by left ventricle. And your apex of the heart, that is the outermost lowermost part of the heart, lowermost part of the heart is formed by, this is called apex of the heart. Apex of the heart is formed by left ventricle. So what are all the things I need to say? Your SVC, your SVC, your right atrium, your IVC forms the right heart border. Your right ventricle forms the inferior border, and your left heart border is formed by aortic knob, pulmonary trunk, left atrial appendage, and left ventricle. And your apex, outermost, lowermost left heart border is formed by your left ventricle, and it is not the right ventricle. Right. Then, so this is with respect to heart borders. Then you can need to speak about heart. What is that? Then you need to speak about your heart size. How to measure heart size? Let me show you how to measure your heart size. So look at this. Let me say how you need to measure your heart size. Okay. Now, what do you mean by cardiomegaly? In an X-ray chest, you need to measure cardiomegaly. How to measure cardiomegaly? It's very, very simple. You need to draw a line above the level of the diaphragm. So here you need to draw a line. Just above the level of the diaphragm. From here to here. So let me say from wall to wall. So this is called wall to wall. So this is called as wall to wall. Let me say this distance is C. This distance is C. Otherwise known as wall to you need to measure from right corner to the left corner. Wall to wall. This is C. and then you need to measure. So this is called transthoracic diameter. This is called transthoracic diameter. Then you need to measure your heart size. How to measure your heart size? So draw a mid-sternal line. Draw a mid-sternal line. Draw a line on the outermost right heart border and draw a line on the outermost left heart border. The distance between mid-sternal to outermost right heart border is A, and the distance between left heart border to mid-sternal line is called B. So what does it mean? A plus B is equal to heart. So A plus B is equal to heart, whereas C equal to lung distance. Remember, normally A plus B divided by C. That means how much your heart occupies the volume of the chest. It is usually less than 50%. If it is usually less than 50%. If the transthoracic distance, so this is transthoracic distance, this is transcardiac distance. So if your cardiothoracic ratio, what is called the cardiothoracic ratio? Cardiac distance is A plus B, thoracic distance is C. When this is more than 50%, if this is more than 50%, it is meant that the child is said to have cardiomegaly. For example, let me measure from here to here. Let me measure from here to here. It is somewhere around 9 centimeter. And let me say A is around 3 centimeter and B is around somewhere around 6 centimeter, or else I can say 5 centimeter. So 3 plus 5, 8 divided by 9. So it is more than 50%. So when A plus B, that is the distance between mid-sternal and right heart border, plus B, the distance between mid-sternal and left heart border, when A plus B is more than C, that is transthoracic distance, the child is said to have cardiomegaly. Remember, cardiomegaly should be interpreted in posterior anterior view. Cardiomegaly should be interpreted in posterior anterior view. It should not be measured in anterior posterior view, because in anterior posterior view, your heart size will be pseudo apparently large. Your heart size will be apparently large because it is very close to the X-ray beam. That's why cardiomegaly is said to be present only when the cardiothoracic ratio is more than 50% in the posterior anterior view and not in anterior posterior view. Right? So this is with respect to heart, and there are various shapes of the heart that will be discussed in our subsequent sessions. So what are all the things we saw right now? Whenever you are given any chest X-ray to read, kindly confirm whether that chest X-ray was taken recently and it belongs to that patient. So name, age, sex, date is very important. Only confirming that this X-ray belongs to the patient, you need to put the X-ray in the lobby and start reading. You need to put the X-ray in the lobby and then you need to start reading. Okay, right. You will have an exclusive detailed discussion of X-ray chest. These are all tidbits. Detailed discussion will be done in our Sushruta batch in coming Friday. Right. So this is with respect to the basics. First point, confirm whether it belongs to that patient. Second point, ABCDE approach. A stands for airway, B stands for breathing, C stands for cardiac, C stands for cardiac, D stands for diaphragm. So what happens to with respect to diaphragm? Look at this. Let me see about, so where is the diaphragm? This is the diaphragm. What are all the things you need to see in the diaphragm? So look at this. This is our diaphragm. So this is the right diaphragm. Look at this. This is the right diaphragm. Uniformly I can trace. And look at this. This is the left diaphragm. This is the left diaphragm. Uniformly I can trace. Right diaphragm is little bit, okay. So right diaphragm, left diaphragm. Remember, Usually right diaphragm is little bit up compared to left, not so much up because of the presence of liver here. Usually you can trace diaphragm from here and then it comes the hard border and then you can trace the diaphragm down to the other side. This is to the other side. Remember, what are all the things you need to see in diaphragm? Whenever diaphragm is irregular, whenever your diaphragm is irregular, for example, let me see, whenever your diaphragm is irregular, particularly on the left side, what will happen? Your intestinal shadows will come out. Your intestinal shadows will come out of the abdominal cavity into the chest, producing your congenital diaphragmatic hernia. Producing your congenital diaphragmatic hernia. Second, below the level of diaphragm, you have liver. The liver is usually white in color, like your soft tissue. Your bone is white in color. Your liver is white in color. Your soft tissue is white in color. Your heart is white in color. Only black colored thing in X-ray chest is your lung. So below the level of the diaphragm, you will have white colored liver. But when below the level of diaphragm, if you have a rim of black colored thing, a rim of black color, this is called air under diaphragm. This is called air under diaphragm, indicates that there is an underlying perforation of the intestine. Particularly it occurs in case of typhoid or it can also occur in TB abdomen. It can also occur in TB abdomen, air under the diaphragm. And one more point. What is that one more point? The one more point is, look here. One more point. What is that one more point? Look at this. This is your right diaphragm. This is your left diaphragm. When one of the diaphragm is at the above the level, it has to be in above the level. That is, instead of being at the lower margin of the heart, if it is touching the middle margin, or if it touches the heart somewhere above what it has expected to be below, it means that the diaphragm is pushed up, but the border can usually be visualized. So liver will come here. Liver will come here. What is the condition called as? That condition is called as eventuation of diaphragm. That condition is called as eventuation of diaphragm. Eventuation of diaphragm is nothing but your one side of the diaphragm wall is weak, so that the liver is pushed up, maybe on the right side, and intestine or stomach bubble is pushed on the left side. But there will not be any herniation of the contents of the abdominal cavity into the chest wall, because in diaphragmatic hernia it is defect, so that it can pass through the defect, whereas it is weak, so that it is pushing up but not going through it. That is the difference between eventuation as well as diaphragmatic hernia. Right. So what are all the basic things we saw? Right. So these are all the basic things: airway, breathing, cardiac, diaphragm, and then extras. Extras means what? Level of the diaphragm, as I told you. What do you mean by extras? Whenever you are given an X-ray chest, invariably you will look into the lung. Invariably you will look into the lung, or invariably you will look into the heart. But remember, there will be so many points in your bone and soft tissue, right? Let us see one by one. Extras. So instead of going directly to lung, airway, diaphragm as well as cardiac, let me go directly into extras first. Okay, let us see what are all the extras. Okay, done. Extras. So what is this X-ray? This 5-year-old female met with a road traffic accident. What are all the things I told you to see? Look at the trachea, look at the volume of the right lung, volume of the left lung, Look at the heart, look at the diaphragm. Okay, there is some amount of homogeneous opacity on the right lung. Leave alone that. It was told to you to look into the soft tissue. X-ray is a place where there are only two colors, black as well as white. Black means air that should be present only inside the lung. White means everything else is white. When you have black discoloration in the place where white has to be present, it means that air is misplaced to some other place. Whereas when you have white color inside the lung, it means your air is replaced by something else. It can be a fluid, it can be an pus, or it can be a blood. Look at this. In this X-ray, look at this. Look at this air. What is this? Look at this air. The air is in the chest wall. Look at this. The air is in the chest wall. So whenever you have air in the chest wall, it indicates that the child is having underlying subcutaneous emphysema. Look at this. Air is present, air is present, air is present. When we were reading about this X-ray, do you find any abnormal black thing in the soft tissue shadow? No. But when you look into this X-ray, there are so many blackish discoloration in the places where soft tissue has to be present. So this abnormal black discoloration in the places of white colored things or soft tissues, it is said to be subcutaneous emphysema. Mainly it can be due to a road traffic accident, or it can arise as a result of asthma. So this is called as subcutaneous emphysema. First case. Second case, 3-year-old met with a road traffic accident. Again, let us trace. Airway is fine and lung volume is okay. Right lung volume is okay. Left lung volume is relatively low compared to right lung volume. And look at this heart. Heart is relatively normal. And I am tracing the right diaphragm. I am tracing the left diaphragm. But apart from that, it was told to my kids to look into the soft tissue and bones. So clavicle and humerus, scapula, and read all and look at the vertebra from above, either downwards or upwards. So vertebra is normal. Look at the ribs, 1, 2. So let's go from below upwards. Normal, normal. But what is this? Look at this. There are fractures. Look at this. There is a fracture in the rib. So point 1, extras. You need to come from outwards to inwards. From outwards, look at the soft tissue shadow. Any black colored thing in the soft tissue shadow is subcutaneous emphysema. Then you need to look into the bones. Clavicle, vertebra, then followed by ribs as well as humerus and scapula. These are all the things you need to see. Particularly, you need to see in the context of the history. Here there is a road traffic accident. Road traffic accident can lead to what? Rib fracture. So you need to look for those rib fractures in this case. So this is a rib fracture. First, subcutaneous emphysema. Second, rib fracture. Third, so what is the thing that is so obvious in this X-ray? So this is a 2-year-old child, boy, presenting with the cough for more than 2 days. Whenever any child comes with the cough and fever, invariably you will think in terms of a pneumonia. Pneumonia means what? Air in the alveoli is replaced by some pus. So what will happen? You will find some white colored dots or white colored patches or white colored opacities in the lung. Look at this. You can see white colored opacity is in the lung. So here also some white colored opacity is in the lung. So let me say a pneumonia involving the upper lobe. But as it was told to you already, trace A, B, C, D, E. Airway is absolutely fine. Second, and Breathing, left lung volume is okay, right lung volume is okay. C stands for cardiac. Cardiac is relatively normal size. Diaphragm is normal. So excluding that extras, there are no rib fracture, something, no. Is there any subcutaneous emphysema? No. But look at this. Look at this. There is widening of the anterior end of the ribs. Look at this. There is widening of the anterior end of the ribs. Look at this. The anterior end of the ribs are widened. Look at this. The anterior end of the ribs are widened. Here the anterior ribs of head is widened. Anterior rib is widened. So what is this called as? Look at this. In this X-ray we don't see much widening. But in this X-ray the anterior part of the ribs are widening. Whenever you have this widening of anterior ribs, it is termed as rickets. It is termed as what? Rickets. Okay. Not only you need to look for the anterior widening of the anterior border of the ribs, you can also look into the humerus. You can also look into the humerus. Look at this. The humerus has got cupping and fraying. The humerus has got cupping. This child is admitted for pneumonia. This child is admitted for pneumonia. But when we saw this one, look at this. So this is called cupping and fraying. This is called cupping and fraying. One second. Look at this. This child had had cupping and fraying of the upper end of the humerus. Cupping and fraying of the upper end of the humerus. Again, this is a case of rickets. Then finally, as I told you already, look at the clavicle, look at the vertebra, look at the ribs, look at the scapula. Clavicle and then ribs and then scapula you saw. Now let's trace your vertebra. So this is a 4-year-old child, fever and chronic back pain. Look at this. When we trace here, yes, I could see some paravertebral shadow here. So this paravertebral shadow is nothing but what? Port spine. Paravertebral shadow is nothing but port spine. And again, the last X-ray for today. What is this? 6-month-old child with pancytopenia and hepatosplenomegaly. 6-month-old child with the pancytopenia and hepatosplenomegaly. Normally, when you see any bone, let us go, when you see any bone, in any of these X-rays, the bones, you have a cortex and you have a medulla. You have a cortex and you have a medulla. Cortex is thick and medulla is thin. So inside the bone, you have a marrow. If you have a marrow, the area, the inside part of the bone should be black because it contains marrow and not bone. But look at this. Here, the entirely it is made up of thick bones. Look at this. There is no medulla at all. In any of these X-rays, there is no medulla at all. So this is called as what? Bone within bone. What is this called as? Bone within bone. And this is called as osteopetrosis. Your marrow cells are replaced by bone. Whenever you have a child with pancytopenia, particularly an infant, along with hepatosplenomegaly. Why hepatosplenomegaly? Because marrow cannot produce your blood cells, as a result of which your liver and the spleen are trying to producing it. As a result of which you will get hepatosplenomegaly. So any child with pancytopenia, particularly an infant with hepatosplenomegaly, take an X-ray chest. When you see bone within bone, it is a case of osteopetrosis. So with this, we will finish our today's topic. Let's continue our topic for tomorrow.